तो nasal pits, stomatodeum, primitive palate, nasal sac, anterior nares, bucconasal membrane, McGovern's technique, mitomycin C prevents synechia formation, Chard syndrome, coloboma of eye, heart disease, atresia of nose, retarded growth and development, genitourinary defects, ear abnormalities, alar cartilage, lateral crura, medial crura, upper lateral cartilage, sesamoid cartilage, septal cartilage, rhinoplasty, nasion, rhinion, lymen nasa या lymen vestibuli, nasal valve interior, lower border of upper lateral cartilage, anterior end of inferior turbinate, eddy current on expiration, ventilate the sinus, vestibule, stratified squamous epithelium, folliculitis is equal to nasal vestibulitis, olfactory epithelium, upper one third 10 to 15% air यहाँ पे पहुँचता है, most air pass through middle part, respiratory epithelium is most dominant, turbinates are bones, superior turbinate posterior one third lateral wall पे होता है, middle turbinate posterior half of lateral wall, inferior turbinate whole lateral wall, superior and middle are part of ethmoid bone, independent is inferior, concha bullosa, sinusitis, middle turbinate polyp-like appearance, hypertrophic turbinate, nasal obstruction, inferior turbinate, mulberry appearance, partial turbinectomy or turbinate reduction by cutting the lateral part, lamina papyracea form the medial wall of orbit, superior turbinate, middle turbinate, uncinate process, cribriform plate form roof of nose, weakest part of base of skull. Perpendicular plate of ethmoid, inferior turbinate, two different bone articulate with ethmoid. Ethmoid sinus, pain with movement of eye, orbital complication, junction of anterior one third and posterior two third of inferior turbinate is equal to highest point. Contains nasolacrimal duct guarded by valve of Hassner, downwards, backwards, laterally, dacrocystorhinitis, antibiotic syringing, dacrocystorhinostomy. Infants massaging medially and downwards. तो इसमें एक बार फिर से downwards, backwards, laterally. Endoscope of nose, flexible or rigid, gray, green equals to 0 degree, red 30 degree, black 45 degree, yellow 70 degree. Anterior group of sinus, frontal, maxillary and anterior ethmoid. Posterior group of sinus, posterior ethmoid and sphenoid. Middle meatus most congested. Osteomeatal complex, opening of 3 sinus. Frontal, maxillary and anterior ethmoidal. Bulla ethmoidalis, ethmoidal sinus. Uncinate process in fundibulum between the lateral wall and uncinate. Maxillary sinus. Hiatus semilunaris between bulla ethmoidalis and uncinate. Frontal recess, frontal sinus. FES, functional endoscopic sinus surgery. Uncinectomy, also known as infundibulotomy. Synechia formation, nasal pack 4 days, mitomycin C. Gauze pack 4% xylocaine plus adrenaline anesthesia. Blake-Kesley forceps, backbiting forceps. Superior meatus, posterior ethmoidal sinus. Sphenoethmoidal recess about superior turbinate sphenoid sinus.